This is my favorite part of my job. Just letting you know.
Inflicting pain?
It is. I love watching everyone's reactions.
Like, somebody gets some enjoyment out of this.
Okay, so there's tapes on your chest, right? Those are going to stay on for the next 2 more weeks, okay? If they start to fall off, get ooey, get gooey, get gross, no big deal. You can start pulling them off. See how this one's kind of like...
Yeah.
So the next couple of days, it'll probably get worse, and you can just peel it off. No big deal. See how this one's stuck down pretty good?
Yeah.
Actually, it's not even really stuck down that great. But like some of them are stuck down pretty good. Don't try and rip it off when you're in the shower after 2 weeks or so. If they're still on there, you can kind of work into them and get them off that way. Okay. When you get in the shower tomorrow, this time tomorrow, no sooner. Nope. Reason being is because your body heals from the inside out. So I'm pulling the tubes out of your body. You're still going to have a hole there. If you were to shower right now, get water in there. So I want you to wait at least 24 hours. You'll start healing from the inside out. It'll still look like a hole, but you won't have as much. It won't be as likely for the water to get into that cavity. Okay? When you get into the shower, I want you to go butt first. It's what I do. Other people may tell you, do whatever. I just feel like going into the shower with it beating on your chest, it's just not optimal. So for the next couple of days, I would go butt first, let it kind of wash over you. With that being said, you're going to take all these things off, okay? So you're going to take this foam pad off. You're going to take this gauze off, okay? You're going to take this yellow piece off. Sorry. Okay? You're going to take all that off when you get in the shower. Okay? Do not call me and tell me that your nipple is falling off. It does not fall off. It's going to scab. Okay? So you're going to take all this stuff off when you get in the shower. Leave these tapes on, same thing as these. Okay? You're going to soak up your hands really well. You're going to wash your chest. You're not going to just be like, I just want to pet. You're going to wash it. Clean. The cleaner, the better, the healthier, the faster it heals.
So I should use the antibacterial soap still? Or
it's up to you. Doesn't matter. I wouldn't use like Irish Spring scented Mountain Blast, Old Spice scent, or something if it's just like a general Dove, Lever, that kind of sort of thing. You got that. If you don't have any of that, just do the antibacterial for the first couple of days. Just to me, it sounds better. So you're going to take all this stuff off, okay? Like I said, your nipple is going to scab. Blood is good. Okay.
It's connecting up. Right?
Yep. So it's going to scab. It may look bubblegum pink. A lot of people who have darker skin, they're like, what's going on? That's all normal. Okay. I'm going to get this one. So tell me what you're going to do. So you're about to get in the shower. Oh, before you start. Before you start, when you get in the shower, wash your vest. Stop looking. It's okay.
Well, I didn't say because it wasn't okay. It kind of hurt a little bit. But so put my vest in the washing machine?
Yep. I'm sorry if I'm hurting you. I don't mean to. I just want to see it. Yeah. So this one's already starting to scab over a little bit, which is okay. So don't be like, oh my god, this one's not.
It feels so good to not have that on there.
Okay, so start off with, it's tomorrow. This time tomorrow you're going to get in the shower. What are you going to do?
Get in butt first. The water wash over the front of me. I'm going to take these pads off, the gauze off, and the yellow stuff.
Yep.
And I'm going to soak my hands up, wash my chest really good, and then pat it dry. And any parts of the tape are peeling off, I can peel them off gently and throw them in the trash.
Mm-hmm. So then, once you get out of the shower, you've washed this. Make sure you like clasp it together and put it all together when you throw it in the wash, just because it gets caught in funky stuff. I've washed it by itself on like a quick cycle. Throw it in the dryer for like 3 to 5 minutes, and it should be dry. Okay? Doesn't take long at all to dry. You're going to want additional compression. I'm going to put 2 pads on today. Those throw away when you shower. Throw all this stuff away when you shower. Because you would believe people keep it and put it back on.
No.
Throw it all away. You don't need it. Take 2 washcloths. Nice and soft washcloths. Or hand towels. Put them in the 4s. Put 1 on each side. If you don't want the washcloth to rub on your nipple, you can put like a piece of gauze in between each. Most people think it feels fine with just the towel.
Okay, so after I shower and take all this off, when I go to put the compression vest back on, I put the washcloths on.
Yep.
Okay.
Yep. After you pat it dry.
Okay.
Okay. You're not gonna put anything on your scars until everything has healed. There's no crusting. There's no oozing. Okay. So you're gonna want to wait for that. I'm going to put these clear little Band-Aid looking things on where your incisions are, where your drains are. Take them off tomorrow too. Okay? Put your arm down. Stop.
Okay.